live at HIMSS in Vegas, and I'm super excited. We have an amazing practicing clinician, and introduce yourself, please. I'm so glad you're here.
Of course. So my name is Romero. I am the head of clinical success at Evidently. I am a practicing physician. My training is in emergency medicine and in hospice and palliative medicine, and currently work clinically doing hospice work. And at Evidently, really my role is to introduce clinicians to our technology and make sure that they're comfortable with using it in their day-to-day care.
Cool. So you're like the trainer of all the clinicians, sort of.
That's right, yeah. And I also think I'm the translator. I think for a lot of clinicians, their first reaction to any discussion of AI is a lot of fear and worry. That's really fair. Clinicians are held to a standard that is frankly unachievable, which is you must be 100% right all the time. And so often we will come into conversations with clinicians where they're asking, are you 100% right all of the time? And the answer is nobody is and nothing is. And so oftentimes my role is figuring out how do we make sure that this technology meets their hopes and expectations, but also they really understand how to use it well so that they don't end up stumbling upon it in ways that make it less useful to them. And so, yeah, I think that's a great description of my role.
So it sounds like you're building it together with the clinicians. How does that look? What's that like?
So I would say the original technology was developed between our founder, who has really deep machine learning experience. He's a researcher and PhD in that space, and our head of product, Callie Dove McGuire, who is a physician as well, an emergency medicine doctor. And I think actually from that tension, a lot of the product was developed, and I think it was a really useful tension for creating a tool that is rooted in some of the technology of AI, but with the principles of healthcare, the conservativeness, frankly, of healthcare technology adoption intrinsic to it. When we partner with new institutions, we do have a solution for them kind of right out of the box, and fundamentally what that solution is looking through the entirety of the medical record. It can be any medical record, Epic, Cerner, bringing forth all of that data, both structured and unstructured, and then creating summaries about that data for clinicians to use quickly. So as an example, I as an ER doc, if someone comes in, no past medical history, let's say they're nonverbal, and the only information I have about them is that they were feeling dizzy. This is like the classic emergency medicine conundrum. Dizzy, older patient, no history. What this will do is bring forth from wherever in the medical record there might be a description of something that could help me just hang on to anything about who they are and what their experience was, so that I can begin making clinical decisions much faster. So that's one piece of what we're doing. Another piece of what we're doing is taking those same insights and making sure that they're captured on the back end by our coders and by people who can then see really the totality of what clinicians are doing. I mean, I'm sure you've experienced this, but oftentimes clinicians are dealing with 10, 20, 30, 40 diagnoses in a single visit. And the idea of needing to research every one of those by clicking through the medical record, it's just not possible. What this does is do on the front end a lot of that work for docs, so they can say, all right, they do have this history of atrial fibrillation, what was done for that in the past, and very quickly click on that and see all the source documents related to it. Essentially, what we're trying to do is demystify AI for clinicians and say this is a tool, but it's a tool that you can stress test. You get back to the clinical record very quickly with our tool within a click or two, and you can say, actually, no, this is not the right linkage, or actually, this should not be in this location. What we want is for clinicians to feel empowered to use this tool, but also tell us how and when and why it should be working for them.
I like it. It sounds like it's really making doctors better. It's like giving them that source of truth. That's right. Of that documentation in real time. Yep. That really helps them engage, probably alleviating burnout and all the other things.
That's right. As an example, we are working with some transplant physicians. As you can imagine, a transplant physician has to look through just gobs, for lack of a better word, of information in order to make a decision about transplant. These big referral centers they get inbound from everywhere in order to make these clinical decisions. And so what we do is collate that in a way that reduce their need for kind of chart biopsy by 90%. So it just reduced the amount of literal clicking and digging and copying and pasting. And that's ultimately our goal on the provider side.
So I imagine really lives are being saved. I mean, time is of the essence with diagnostics and to treat and to, I mean, it seems like it's the way to, I mean, we should all, now we can do it.
That's right. I think, I hope so. And I also think that when you think about why people go into medicine, it's not because they enjoy clicking through an EMR, right? They go into medicine for the human connectedness to patients. And whenever we can remove some of that cognitive burden and allow clinicians to go back to connecting with their patients in a different way, that is always going to be a win. Because the truth is, something AI can never do is capture the depth of that patient-physician relationship, which we really deeply value. And so the more time that physicians can be spending doing that, and the less time they can be spending on all of the other tasks required to kind of collate this information, the better.
Yeah, well, I'm glad you're here. It's really wonderful to know you're still practicing medicine. I think there's such an added value because you can really be on that journey with the clinicians as well, giving them that added value. You're here at HIMSS. Tell me anything you're really excited about, lessons learned, what you're seeing, any technology. Tell us.
I think one thing that really impressed me, this is my first time at HIMSS, is really the breadth of what constitutes technology in the healthcare space. There are physical things that are being sold here. There's a lot of technology being sold. There's just so many different ways to think about innovation. It's extremely exciting to know that there's so many people trying to fix these problems. I think as a clinician and as someone who's relatively new to tech, didn't appreciate the breadth of innovation that's happening at all times. It speaks to both the opportunity within healthcare, but there's also something that's like really, it feels really American in some way for there to be 9,000 people working on a solution simultaneously, all in a room, trying to figure it out. Like it's very exciting, and there are so many of them that I wonder, how would a healthcare system choose? There's so many opportunities.
So we need like AI for vendor management.
That's right. I mean, and I think, I have come to realize that there probably are, and I think this is happening in real time, kind of ideas about governance and structure when it comes to AI implementation in particular, but I think that it's clear to me that there's a variety of ways that people kind of talk about what they're doing, are talking about what they're doing now versus the future, and I look forward to a day when there's like a clear set of guidelines for what healthcare systems should be looking for in order to implement AI. I have my opinions about what that should be, but I think that a kind of shared industry-wide guidelines around that will be really welcome.
Would you share just a little bit?
Yeah, so I really think that what I come back to is that, one of the core principles of clinical medicine is first, do no harm, right? That's step one. And you think of what does that mean when it comes to technology adoption? To me, that means transparency. So the ability of the end user or people along the way to be able to see what's happening. One of the challenges of AI is that often it just feels like this magical black box where you put in input and then like a rabbit gets pulled out of a hat and you have your output. And I think that is a useful and interesting solution in a lot of spaces, but I think when it comes to healthcare, that can't be the way that you understand your software solution. There've got to be people that, there's the technologists that understand it, but the clinicians actually have to understand what is going on, otherwise there's no way they will adopt it. So I think transparency, I think another piece of it has to be augmenting, not replacing clinical judgment by physicians at the end of the day, or I should say all clinicians, not just physicians. At the end of the day, this is true for anyone. The person in the room is always going to tell you more about what's going on with that patient than anybody else with any other information. And if you don't defer to that one-on-one interaction between those two people, you are making a mistake and you will miss information. So I would say transparency, patient-centeredness, and clinician-centeredness, and then finally really adhering to the same guidelines around patient safety and security that the healthcare does broadly. Those would be my kind of cornerstones.
And I feel like that's coming back to the green room conversation we had before you came on with you, with your hospice kind of mindset of now, quality of life, kind of really capturing that.
Yeah, I mean, I think that one of the things that's true about being a hospice physician that's very satisfying is that you kind of, patients come in with like all of this additional information about who they are, all of this data that tells them how they are, right? Like, how are you doing as a cancer patient? Well, let's look at this tumor marker, let's look at this CT scan. When you enroll in hospice, the question is only how are you feeling in your body today? And I think getting back to that core sense of like, how are the human beings in this interaction and how do we facilitate that human interaction using technology, but keeping that at the center of our priority is incredibly important.
Well, this has been awesome to have you. I really appreciate you coming on today.
Really nice to meet you.
Nice to meet you.
Thanks so much.